We continue to get a lot of questions from viewers who are wondering why we haven't seen a mandatory mask-wearing policy here in Madison, similar to the ones we're seeing in many other cities.
Last week, Public Health Madison and Dane County said it had to do with racial profiling and feared it could spark discrimination in communities of color. Jamie Perez has more on what this all means. Jamie.
Right, so they posted a memo online kind of explaining what all of this means and that it doesn't have to just do with race. They said it also has to do with medical reasons. They're trying to keep people with disabilities in mind, and they also say that there is a problem with enforcing a policy like this. Many people are wondering why there isn't a mandatory mask-wearing policy in Madison. There's even a petition going around with nearly 5,000 signatures asking the city to have one and demanding that a mask distribution program be a part of it. And doctors are growing more concerned about the rise in cases.
You know, from the medical perspective, the jury has rendered the verdict. And really, if we are out in public close to other people, we need to be wearing a mask at this point.
But the answer isn't so simple for everyone, especially when it comes to communities of color. Last week, public health officials said fear of racial discrimination is one of the main reasons why they're hesitant to make mask wearing mandatory. A UW-Madison expert on racial profiling explains why their concern is legitimate, especially for Black men.
We live in a racialized society that doesn't afford people of color the same protection in their mask.
Madeline Hafner said there is an implicit bias that our society has when we see a person of color in a mask. She said they're often perceived as threats, and especially right now, that added stress is making many people of color fearful of how they could be perceived if wearing a mask was mandatory, even if everyone was required to wear one.
It's the impact of how we respond as white people to perceiving people of color in those masks that lay that stress on them. And so I think for us, we need to keep doing our own work to make sure we're not laying an extra stressor or burden on people of color.
Public Health released a memo detailing additional reasons for not making masks mandatory, saying those with medical conditions such as dementia, Alzheimer's, autism, and emphysema could find it too stressful or dangerous to wear one, that those with past trauma could feel unsafe wearing something on their face, racial discrimination, and socioeconomic status that could prevent people from having access to multiple clean masks, and because of that, limiting their opportunity to job and food access. And lastly, enforcement could be problematic, leading to violence and penalizing marginalized groups. While masks are not required, they are still strongly encouraged.
I don't think we want to persecute people who are unable to get face masks with some sort of mandatory order, but I don't think that should be confused with lack of benefit from the medical side to mask wearing. I think that benefit is clear.
Public health officials said they are working on a program to try to make masks more accessible for those who cannot afford them.
Jamie, thank you.